Good evening. My name is Lorraine Sebopelo. I'm a third-year medical student from the University of Botswana, and I'll be talking about mapping global neurosurgery research collaboratives, which is a social network analysis of the 50 most cited articles. So the objectives of this presentation is actually to identify and evaluate the relationships between articles, authors, and keywords in global neurosurgery. The majority of patients in need of neurosurgical care live in resource-limited settings, and the barriers to optimal care are due to clinical, socioeconomic, and health system-related factors. Global neurosurgery is an intersection between neurosurgery and public health. It researches, educates, and advocates for universal access to neurosurgical care. The WFNS, which is the World Federation of Neurosurgical Societies, recently created a committee to coordinate the global neurosurgery efforts of its member societies, and we will be talking about research in global neurosurgery. Social network visualization was used to illustrate the bibliometric relationships between items. Concerning data analysis, in this symptomatic analysis, searching the web of science was done, which included the terms global neurosurgery or global surgery and neurosurgery. The results were then sorted in descending order of citations, and the top 50 articles with their metadata were exported as text files, which were then used and analyzed with VOS Viewer, which was then used to visualize the networks as directed graphs. When it comes to document coupling, 50 articles were identified, published between 1995 and 2020, and the most cited article had about 102 citations. The bibliographic document coupling graph identified 5 clusters organized around the one here in red, and Park in purple, as well as Elegala in yellow, and Abdelakdir in green, and lastly, the Warren in blue. And when it comes to co-authorship analysis here, there is, of the 50 most cited articles, it revealed 10 clusters composed of 147 authors. The cluster of the WFNS Robot Training Center, indicated here in blue, actually had the strongest links. The most represented co-authors were Kiwi Park, with 14 articles, as well as Franco Savade with 7 articles. There were also 65 common keywords or co-occurrences among the 50 articles. Older keywords refer to the treatment of hydrocephalus, while more recent terms were focused on neurotrauma, neurosurgical workforce density, and myelomeningocele. This study was actually the first to analyze the landscape of global neurosurgery research, and it identified the most influential studies, which highlighted the disparities between high-income countries and low and middle-income countries. The one showed that low and middle-income countries have extremely high burden of disease, given the available specialist workforce. He also highlighted that sub-Saharan Africa and Southeast Asia needed immediate attention. The Global Neurosurgery Research Network is highly connected, indicated by the links between individuals of the same cluster and those from different clusters, which were very dense. The WFNS has contributed substantially to global neurosurgery research. When it comes to co-citation and co-occurrence, there's a transition from the more general global surgery to a more specific global neurosurgery themes. And the most cited global neurosurgery articles is organized around 3 specialties, which are neurotrauma, pediatric neurosurgery, and the health system strengthening. Concerning neurosurgical subspecialties, research has focused on decreasing the burden of pediatric neurosurgical diseases like hydrocephalus. Neurosurgical workforce density is a prominent theme among the most cited global neurosurgery articles. Organizations like the WFNS have facilitated the training of neurosurgeons from underserved regions through scholarships to overcome the workforce deficit. However, the training of specialist neurosurgeons alone will not be enough to meet the surgical needs of the low and middle income countries. For advocacy, institutions like the WFNS and the World Health Organization are among the most common words in global neurosurgery literature. Headed by Gail, the Licensing Committee uses the findings of global neurosurgery research to advocate for universal neurosurgical care. And in conclusion, we highlighted the emerging themes in global neurosurgery and identified articles essential in global neurosurgery. reading list, as well as elucidated some prolific research collaborators and researchers. Co-author clusters, which are far apart, could also benefit from collaborations. This is like in cases where there's the North African and East African co-author clusters, which have enough intermediate connections to form an African global neurosurgery research collaborative. Thank you so much for your attention, and here are the references. Thank you.